But
I mean,
Good
that's what it's
stuff.
for. So it is so wonderful that it was so widely distributed and used.
yeah, we're lucky, thanks to Delta Dental Minnesota Foundation for making sure we have a coalition. And well, how are we doing? There's Mavis.
Yeah, we're
Mavis.
coming up right on noon, so we can probably start doing introductions and
Yeah, that
getting the
sounds
names out
great.
there.
Um, so as usual, we would love it if you put your intro in the chat. Just tell us, you know, maybe your title, who you work with. Um, let's see. How about favorite winter food? How's
It's
that
called
sound?
comfort food, Nancy. It's almost
Yes,
any kind of it will do.
I actually just made mine. I don't have time to eat it, but it's I've been making sourdough.
Oh,
So I made some sourdough with peanut butter and blueberry jam, and it's sitting right here. It's going to tempt me for the next hour. So yeah, welcome everyone. I'm Nancy Frank Wilson, and I do these in partnership with my friend and colleague, Jane.
yes. Hi,
Jane,
everybody. Jane Neubauer. Most of you, I think I know almost everyone on here so far today. So it's great to see you all kicking off the new year with us. That is wonderful.
yeah,
Hopefully, we will see a few more jumping on our topic today. It's been kind of a hot button lately, so it seemed like a good time to just go through some of the mechanics and information about fluoride, and thought that might be a good place to start our new year off this year.
yeah,
So,
I agree. And if this is a topic, and hopefully we'll have more information come out on this, but yeah, we can get started. Um, community water
I love
fluoridation.
Claire.
What's that?
Claire is saying popcorn is her favorite food, which I can't argue with
Winter.
that. It's for
Winter
winter.
food.
Winter.
Winter.
Oh,
Oh, Claire, that sounds so good. Oh my
Yeah.
goodness. All
that
right.
would be my all year topic,
Uh,
except the stick of butter that I put on it probably mitigates the
That's the best.
goodness of it. So,
I I just read it's a very healthy snack.
yay.
So, all right. Community water fluoridation, which celebrates its 70th anniversary this year, has been so successful, leading to dramatic declines in both the prevalence and severity of tooth decay, that the Centers for Disease Control and Prevention identified it as one of the 10 great public health achievements of the 20th century. So we have two presenters today. Our friend and colleague, Jane Neubauer. She has worked with Partnerships for Health as the Regional Dental Innovations Coordinator in Region 4 since the program's inception in 2020, serving Becker, Clay, Otter Tail, and Wilkin counties. Since 2008, Jane has also facilitated oral health prevention efforts through West Central Initiatives Early Childhood Dental Network, or the ECDNs, involving Douglas, Grant, Pope, Stevens, and Traverse counties and the White Earth Nation. Jane believes that collaboration is the key to creating healthy families, strengthening communities, and to maximizing limited program and systematic resources. And you do walk the walk, Jane. You don't talk the talk, you walk the walk. Our, we're also honored to have another presenter. Maria Spitall is a compliance engineer with the Drinking Water Protection Program at the Minnesota Department of Health. She has a degree in civil engineering from the University of Minnesota and has been working at MDH for the past 2.5 years. As a part of her job, she works with water systems throughout the state to ensure that municipal drinking water fluoridation meets the requirement of the state of Minnesota and the Safe Drinking Water Act. So welcome all, and thank you to our presenters. And we're going to start with Jane, and then we will have Maria.
Thank you, Nancy. Are you gonna advance the slides? Will you be sharing the PowerPoint from us? Or did you want me to?
I was going to have you do it. That's okay.
Okay, all
Just be
right.
easier, I think.
You want to, or maybe I can share here. Where are we? All right, so here we go. Let me get back to the top here. All right, is everyone able to see what we're seeing there? Let me see if I can get that
We
into
are seeing it.
slide mode. All right, well, we are going to talk today about community water fluoridation. And what we kind of discussed is just starting from the beginning. What is it? Where did it come from? Just a lot of the information that will help us all to better understand what it is, why it's out there, and how it even originated. So again, thanks, Nancy, for help facilitating with us today. We will jump right in. And this is really, as always, a very laid back group. So please feel free to ask questions if there are things that come up. Maria will also be sharing information from the Minnesota Department of Health once I have concluded, and she may have some of the details and information that we're not covering in the first part of the session as well. So these are just some of the things that we will cover today, what it is, the history of community water fluoridation, how it works, where sources of fluoride come from, a few statistics that we will go over, and we'll look at the impact. As Nancy said, it has been a tremendous part of improving oral health over the years. So we'll also talk about fluoride toxicity, what that is, what that means, how to avoid that, and then we'll share some resources with you, and we'll have a discussion kind of at the end of this. As Nancy said, with the change in administration, there has been some talk about eliminating community water fluoridation, and so that's always something that has been on people's minds as we roll into the new administration. So again, just feel free to jump in and ask questions at any time if you want. So what is fluoride? So fluoride is the iconic form of fluorine. So it's the 13th most abundant element in the Earth's crust. It's natural. It comes from the Earth. It's released into the soil, into the water, and into the air. It is closely correlated and directly impacts calcium. And the highest concentration is found in our bodies in calcified tissues. So in our teeth and in our bones. So we know that it helps to make those things stronger. Where do we find fluoride? Yes, Amy, did you have a question? Oh, all right. I thought there was a question there. So where do we find fluoride? So we find it, trace amounts of it in food. It's found naturally in various foods. Coffee and tea is a big one that it's naturally found in. And we find it in well water as well as community fluoridated water supplies. So many of us who live in rural Minnesota, we have well water, right? We don't all have access to community water sources, and there is naturally occurring fluoride in some of those. And then, of course, there is fluoride found in many different types of dental products, dental toothpaste. You can see how much is contained in just a pea-sized drop of that. All of your toothpaste boxes or containers or tubes, whatever you want to call them, will share with you or will tell you what amount of fluoride is contained in that product. Obviously, there's fluoride in mouthwash as well, and then in fluoride varnishes. That's one of the things Nancy talked about already. Yes, Nancy.
I'm just going to say the ppm is parts per million.
It is correct. Yes.
Okay.
Thank you for clarifying that. Yep. So we will continue on. That is where we find fluoride. So what is community water fluoridation? So that really is the controlled addition of a fluoride compound into a public water supply. So it is designed to achieve a concentration that's optimal for dental caries prevention. When it is added to your water supply, it is added there for the sole purpose of preventing cavities. So in 2015, based on the widespread availability of fluoride in drinking water and oral care products, the USPHS simplified recommendations for optimal fluoride concentration, and the new guidance came out with community water fluoridations to adopt a concentration of 0.7 milliliters of fluoride in drinking water. So that again was something that was researched and studied and was determined to be the optimal amount of fluoride in the drinking water supply for communities. That was at that point then when public water systems nationwide commenced fluoridation at that parts per millimeter level of 0.7. Okay. So what's the history? Why did we even achieve this? Why is this here at all? So way back, in the day, and this was actually even prior to 1901, but a young dentist in Colorado named Dr. Frederick McKay noticed a strange trend that was happening in Colorado Springs. Residents of the town had some distinctive brown stains on their teeth. However, despite those stains, they actually called it Colorado brown stain at the time. Their teeth seemed to be unusually resistant to decay. So they had fewer cavities, but they had these modeling that researchers found that over the course of some, exploration and things, that it was due to this town's water supply, which contained abnormally high levels of fluorine. So this prompted dentists to begin investigating whether it was possible to reap the benefits of that fluoride, but yet reduce the downsides of it, which was the staining of the teeth. So I thought that was kind of interesting. In 1945, then several cities in Michigan, New York, and Illinois and Ontario tested the effects of the water fluoridation in a community water supply, and they tested it at 1 to 1.2 milligrams per liter. Grand Rapids, Michigan was actually the first city in the world to implement water fluoridation. And interestingly enough, the study of this initial fluoridation went on for 15 years, showing that dental caries were reduced 50 to 70% among children who lived in those communities with fluoridated water. So a huge reduction was seen for those communities with water supply. In 1962, then, health officials in the US created the optimal level of range of fluoridation in the water supply. Again, there was a broader range there from 0.7 to 1.2 milliliters, with the lower concentration recommended for warmer climates, which I thought was interesting. And that was simply because there was more water consumed in the warmer climates than there was in those colder climates. So interesting. So how does it work? How does water fluoridation actually work? Fluoridation, again, it protects teeth in two main ways: by preventing the development of caries through ingestion of drinking water and during the tooth forming years. So again, those younger children, babies, infants, even prenatal in the womb, those things are affected through this ingestion of water, of fluoride in the water. And then, of course, there's the contact of fluoride on your teeth throughout life, right? In the morning and the evening when we brush our teeth, we're using a fluoridated toothpaste, or those rinses or those other products. So all of those things affect our oral health throughout our life. How it actually works is it prevents tooth decay by making the enamel more resistant to acids. It accelerates the buildup of healthy materials. So as we mentioned earlier, it makes our teeth and bones stronger, therefore reducing that decay. Studies even show that in some cases, fluoride can stop tooth decay that has initially started. So another great benefit of it there. In children younger than 6, so what we see here, of course, are those baby teeth that, the primary teeth that are falling out, right? It helps to make the enamel of the permanent teeth more resistant to, again, that bacteria and those acids from forming on the teeth, causing those cavities. So it's really an important part of that development for those younger children. So fluoride consumption, what does that look like? Among children 6 months to 14 years, drinking water accounts for 40 to 70%. I realize that's a broad range, but again, it would depend on what that child is consuming at those parts of their time in their life. So that was according to a public health report. For adults, drinking water provides 60% of your total fluoride intake. Presumably, adults are probably consuming more water routinely than young children are. Accidentally swallowing toothpaste accounts for about 20% of total fluoride intake in very young children. So those of us who know or have young children or grandchildren, we know that sometimes it's hard to get them to spit. out the toothpaste. That's also why the American Dental Association recommends not using toothpaste for children younger than 2. So, other major contributors to total daily fluoride intake are commercial beverages and then some solid foods. And we'll look at some of those examples here in a minute. About 50% of fluoride that is absorbed is retained in the body, with all but 1% of that being stored in your bones and teeth. The other 50% is excreted through urine. And then in those young kids, again, up to 80% of the absorbed fluoride is retained because more is taken up in the formation years of those bones and teeth. So just some interesting stuff there. Here's some examples of foods that contain fluoride. So again, black tea is a big one. There's a lot of fluoride that is contained in black tea. Yep. Coffee, those seafoods or shellfish, shell foods have a higher concentration of it. Some bottled water does. You can read that on the contents of your bottle. Not all of it does. Interesting, raisins, so things like that. And I won't read through all of them, but we do have a nice listing here, and we can share this presentation if you have questions or have people that have questions about that. Some of the things that really don't, tomatoes, bananas, eggs, carrots, peanut butter, things like that, there really isn't any fluoride in those types of things. So, all right, so who makes decisions about community water fluoridation? And Maria, I believe, is going to go into this in a little bit more detail, which will be specific to Minnesota. But a community water system supplies water to the same population year round. It has to serve at least 25 people in their homes or at least 15 homes. So that would be, any of those things would be considered a community water system. The federal government has set 2 different levels for fluoride in the water. One is the maximum allowable amount to prevent toxicity. So again, we'll talk about that a little bit later. And the other is the optimum level. So that 0.7% or parts per milliliter is the optimal level that has been recommended. State and local governments decide whether to implement water fluoridation. So again, often voters themselves make that decision. It is something that is put on ballots at times on whether or not to have that community water fluoridation added in their community. Some states have laws that require water systems of a certain size to provide that fluoridated water. And then, of course, again, as we said earlier, in some areas, the level of naturally occurring fluoride in the water is already at a level proven to prevent cavities. That is always something that is reviewed and considered. All right, there we are to the next one. These are just a few statistics about the total population in the U.S. on a community water supply. So as you can see, a very large percentage of the United States does have access to a community water source. There's about 72% of the population is on a community water source that's receiving that fluoridated water. So there's a total of 51,000 communities in the United States that have access to that community water fluoridation. All right, so what is the impact of water fluoridation on dental caries or on cavities? There was a study that was done in 2015 that included 20 prospective observational studies. The results showed that children receiving fluoridated water had 35% fewer decayed, missing, and filled primary baby teeth, and 26% fewer permanent adult teeth than children receiving unfluoridated water. So again, just a huge, huge impact that fluoridation has on our children's teeth. Fluoridation also increased the number of children with no decay in their baby teeth by 15% and the number of children with no decay in their permanent teeth by 14%. So that study again was confirmed by 2018 with a cross-sectional study on the associations between fluoridated community water and dental caries in the United States. Again, it showed the results that living in a country or a county, I'm sorry, with which 75% or more of the drinking water contained that recommended level of fluoride, there was a 30% reduction in the rate of caries in those primary teeth and 12% in the permanent teeth. So It also did show some evidence that just the addition of fluoride to drinking water can also help prevent dental caries in adults. So that is something that, of course, we talked about a little bit earlier. Adults drink a little more water probably than younger populations do. So huge results, lots of studies out there. These are just a few of them. We have some resources at the end if you want to look at some different studies or different research that's available out there. There's lots of it. So what is fluoride toxicity? So this is probably at the heart of most of the controversy that has occurred, over many years about fluoride and community water fluoridation. It's a thing, it's real, there's no doubt about that. Fluoride toxicity, it's a condition in which there are elevated levels of fluoride in the body. Although fluoride is safe for dental health at low concentrations, when it's consumed in larger amounts, it is dangerous. So obviously we don't want children eating tubes of toothpaste or drinking, mouthwash or any of those things that contain high levels. When we talk about that natural salt of fluoride, the lethal dose for most adult humans is estimated to be at 5 to 10 grams, which when you comparatively look at that, which would be equivalent to about 8 tubes of toothpaste. That they would have to consume in order for it to be toxic for an adult. So this is what it looks like. So this is one of the negative effects of dental fluorosis. This is what we talked about at the beginning when the dentists in Colorado Springs saw this trend with people that lived in their community. It creates these brown stains or brown pitted stains on people's teeth if they are consuming too much fluoride. Again, it creates them to have a harder teeth, but it creates those stains for that fluorosis. What are some of the other health risks from excessive fluoride? So again, swallowing a small amount of toothpaste is usually not harmful. We do always want to watch our children. Children should be monitored when they're brushing their teeth. If it's less than a pea-sized amount, nothing bad will happen at all. Okay. If the swallowed amount is 5 to 10 grams, it can cause a stomach ache, gastrointestinal issues, diarrhea, vomiting, that kind of stuff. And once again, I mentioned this earlier, but in order to be fatal, an adult would need to literally eat about 8 tubes of a standard tube of toothpaste for it to be fatal. Obviously, that would be less for smaller kids. If you are concerned, or if there's ever a concern about a child that you think has consumed too much toothpaste, obviously that would be a good reason to keep the poison control number handy. There's always, when we have young children around, it's always good to keep that handy. But they would be able to guide you and direct you as to what the appropriate steps would be if a child, or an adult for that matter, did consume more than what is recommended for toothpaste. It's also chronic and excessive fluoride intake is also associated with skeletal fluorosis. So again, what that does is it can affect your bones, right? Your bones and joints and things like that. It could create that joint pain, stiffness, muscle wasting, those neurological defects. It's extremely rare in the United States, and there is absolutely no evidence or research out there that supports that it is caused by the recommended level of fluoride in public tap water. So there is no evidence to support that community water fluoridation has any impact on this. It would be that it would be consumed from other areas. There have been concerns that fluoride may be linked to a variety of other health conditions. You will see various topics about that if you Google it or if you research it a little bit. However, so far, research studies have found no convincing evidence to support any of these concerns to be valid. Fluoride controversy. So again, this is a little bit of what we've talked about, and part of the reason why we felt this might be a good topic to cover as we kick off the year. Quite frankly, there has been opposition to fluoride or fluoridation in your water since it was initiated in the 1940s. Like everything, when something new comes about, there's going to be different opinions and different perspectives on those topics. Way back in the 1950, conspiracy theorists baselessly claimed that fluoridation was a communist plot to undermine American public health. So again, there's just a wide variety of things out there, people, topics, a lot of them without any basis whatsoever. Um, it has recently become another topic in political issues. So just what we were talking about, you hear this as we discuss new administration and new uh, folks that would be taking over in the health and human services area. Again, what you generally see, as with any political thing, sometimes it ramps up, it gains a lot of attention, but basically it continues to spread throughout the world as a good public health measure. And again, this is what we talked about at the beginning, the U.S. Surgeon General, the American Public Health Association, the Royal Commission on the National Health Service, Australian Medical Association, and the list goes on and on and on. They support fluoridation, and they cite a number of international scientific reviews that indicate there is no link between any adverse health effects and exposure to fluoride in drinking water at levels that are below the maximum acceptable concentration levels. So the Center for Disease Control and Prevention listed water fluoridation as one of the 10 great public health achievements in the 20th century in the US, which Nancy referenced at the beginning. Right up there along with vaccinations, family planning, the recognition of dangers of smoking, and other big public health achievements. So there are lots and lots of online resources. At the end here of our presentation, we have listed a lot of the resources we used for this presentation. Again, you could spend days researching it and finding many different ways or information about community water fluoridation. There are also some really nice printed resources. I suggest and recommend that people, if you're working in the public health arena or if you're working with children and families, it might be a great idea to keep some of these resources on hand. We can email them out to you as well, but there's a boatload of information on the CDC website, on the Minnesota Department of Health website, and then this particular one from the CDC lists a whole bunch of resources where you can find some good quality information to help that as well. This was kind of a fun one. There's some Minnesota Drink It Up Minnesota tap water. We see this quite often, especially if any of those of you who work with early childhood populations, people think it's better to use bottled water with their children, right? Or with formulas, things like that. And the actual recommendation is to use that water right out of the tap in most cases. So these are just some of the summary points that we've talked about. Oral health has a direct effect on your body, mind, emotional, and social wellness. Tooth decay, also known as dental decay or dental caries, is a major health concern worldwide. Fluoride is a mineral that is naturally occurring, and it can help to prevent that tooth decay from progressing. Good oral health, so we avoid that tooth decay. We also know that it means lower rates of cancer, better control of diabetes, opioid prescriptions, all of those kinds of things that are associated and correlated with oral health and overall health. So what do y'all think of that information? How am I doing on time, Nancy? Are we running out or are we doing pretty good?
I think we're doing great. Thank you so much. I learned a lot. I took about a bunch of notes. Dr. Crespo put in the chat that the American Dental Association and the American Academy of Pediatrics support community water fluoridation. The ADA has a brand new chair, and I was on a national conference call with him, and he said, this is a big deal to us. We really want to make sure that we keep community water fluoridation in our nation. And of course, the American Public Health Association as well. And Decala from MDH, Oral Health Program, has a really good link in there to their resources. She's saying you can print them yourselves or request them in bulk from them. And if you haven't taken a peek at people's favorite foods, there's some good ones. Holly Jorgensen likes chili with a cinnamon roll, and I think that just sounds amazing, of course.
Any other questions or discussion?
I have something. She just typed this in the chat as a response to what Holly said. Here, I can turn my camera on too. As a response to what Holly said about posting that poster on the walls, maybe if anyone does any outreach or especially with school sealant programs, if we could maybe even give that to you and you can distribute it out to the schools you attend, or if you work directly with any school nurses. What we've done in terms of community water fluoridation is we used to have these hydration station grants,
Mhm.
and those are currently on pause just because we have to get permission from CDC again to do those. But we would give the hydration stations out with that poster so they could put the poster up where all the kids could see it, and right next to their hydration station so that people know the benefits of drinking fluoridated water. And we also kind of like work with our diabetes program because it also promotes healthy drinking water instead of drinking from like soda and other things like that. So that's also a super fun option that that went to my brain. So
Fabulous.
yeah. And here, I'll put my name in this chat.
Thank you so much for
She
bringing
helps
that
me
up,
with that.
Jakala.
Yeah.
I
Yeah,
know
of course.
personally here in our region in the northwest central region of Minnesota, those hydration stations
Mhm.
and those grants were very popular, and many of our schools were able to put in some drinking stations due to those grant funds. So those are great resources.
Yeah, could you possibly, I hope it doesn't sound weird, if you could send that to me in an email of
Oh, sure.
how that's impacted you. CDC is actually requesting that we send them those materials as further justification for why the hydration stations work, and what kind of reach we have. So
I can do that, absolutely. Here were just a few of the references, some of the places where we found some of this information, so I just wanted to share that too. Nancy, I believe you will be able to share the PowerPoint with the group afterward if for those that are wanting to have it.
Yes, absolutely. I can put a link to it on our resources page, which is on our website. That's probably the easiest way. You could look for that at least by tonight. I can get that on there. But if you want it right away, just send me an email.
Awesome. Maria, would
Or
you
put it
like
in.
to jump in?
Yes, who's that?
Did we have a question?
I thought someone said they wanted to jump in.
Oh, no, I just said
Oh,
Maria, if Maria wants to
oh,
go ahead
okay.
and jump in with
Great.
her
Sorry, I was like, we
information.
love when people jump in.
We do love
Okay,
that.
Recording. Thanks, guys.
Oh.
Just so whoever's listening can hear the end of this, and my recording works out well.
I had a quick question. So I know I came in a bit late and I'm so sorry. Did y'all talk about silver diamine fluoride?
We didn't, and if it's okay, we're working on that for future, if that's okay.
Oh
And
yeah.
we did have a presentation from Apple Tree, actually. Oh, I'm drawing a blank on his name at the moment, but he did that. I think it was March, Nancy, of 2023, because when I was looking back in my archives from previous presentations, I did see that one too, and that was very informative.
Great. And that should be on our YouTube channel, but we are working on some things for that. And Dr. Crespo shared with me some things that Illinois is doing. So I hope we can share resources and talk about that again. I think it's always timely.
Well, it's
And
another
I
one of
cannot.
those topics that there's so much, there's a lot of new or evolving information, and there's just a lot of information that people aren't familiar with. So
I'm just going to make sure everyone's on mute. There we go. Good. All right. Anything else that we want to talk about today? Or I think we'll start saying this. Jane and I've made the decision that our last medical dental integration community conversation, our last regular one, will be May. We've come to find out about so many very similar events like this. But the MOHC, we will host an Infomar and a webinar anytime. So please know that the first Wednesday of every month through May, we'll be doing these at noon. You can always find that information in our newsletters, or you can just plan on it, go to our resources page and put that, put your calendar invite in there. Let's see.
We have, we also are
Yes.
open to ideas or suggestions. We have a
Right.
couple openings yet between now and May for presentations. So if there's a specific topic or presenter that you are interested in hearing from, please let Nancy or I know that as well. We'd love to do that research and get those scheduled. I believe the next one, Nancy, and I was just gonna try and look it up. I believe it is, right, at noon? That would be, I'm drawing a blank on, I can't find it at the moment what the
Yeah.
topic is, but
I wasn't gonna, I can't remember, so I wasn't gonna read it.
and this is part of the dilemma that we face because there are so many great sessions out there already on medical
are.
dental, and we're starting to wear out our presenters. So
Yeah.
we're finding people that are doing multiple presentations on the same topic for different venues, and it gets to be a little bit much for them as well. So
All right. Well,
we
thanks,
are giving them a
everybody.
gift of 8 minutes today, Nancy. So
I
thank
know.
you all for joining us.
It's great to
We-
see everyone.
Yes, we will see you all on the 5th of February, I hope.
I hope so too. All right. Take care, everyone. Enjoy your winter comfort foods. Thanks, Maria.